From the heart of Wayne County, this is Wayne Goldsboro Television, Goldsboro, North Carolina.
Today is Friday. We made it to the end of the work week. It's the 24th of the month of March, 2017, and this is Wayne Goldsboro Television. I'm Wayne Alley. Pat's on assignment. Thank you for being with us here on this Friday. Hope you're doing well. What a beautiful day we have today. Looks like we're going to be in the upper 60s with a ton of sunshine, and that's good news for us here in Wayne County. Oh yeah, lots of stuff going on around the area. We do have a special program for you today. Earlier in the week, Pat and I went over to Wayne Memorial Hospital for a Healthopoly health fair they had. It was based on the Monopoly game, but it was very interesting, a lot of fun, and a ton of information. I mean, there was a lot of people there. It was very crowded, and that's our special program for you today. So this segment, the middle segment, and the final segment of the program on my part will be relatively short. But still, we'll have a lot of good information for you. I want you to listen to this health fair because there's some great information there. And our thanks to Wayne Memorial Hospital and their Healthopoly program, the Live Well program, for making this possible. It was great, well attended, and we thank you for that. First of all, a couple of things. It's also going to be a wellness fair at Wayne Community College, sponsored and provided by Wayne Community College Human Resources. This is for students and employees of the college. And this will be taking place on March 27th. That's Monday, I believe, from 8 until noon. This coming Monday from 8 until noon. Also, don't forget the Ag Day. Young Farmers and Ranchers present, Wayne County Farm Bureau Young Farmers and Ranchers present Ag Day. That's coming up on March 30th from 9 till 3. That will be taking place at Odom Farms on Claridge Nursery Road from 9 in the morning until 3 in the afternoon. It's for everybody, anybody who wants to attend. The Daffodil Festival coming up on the 1st of the month in Fremont, on April 1 in Fremont. All right? Very good. Excuse me. Also, if you're a veteran, active or former veteran, or active or retired, livingthevetlife.com is a website I strongly encourage you to go to. There's a lot of good information there. All right, let's go on to the first part of our program. We're going to Wayne Memorial Hospital. That's up next on Wayne Goldsboro Television.
Hi, Georgia. Georgia Dees is with us. Georgia, what is going on? I saw the parking lot full of cars. What's going on here?
We're having a health fair for all the folks in Wayne County to make sure that they learn how to take care of their health.
Really?
Really? Thank you for being here.
Well, you know what? We got here early, and the place was already packed.
I know. We said 5 o'clock, and everybody comes early, so we planned for
Isn't that great? Well, you got food, for one thing.
Well, that's right, but I see more people at the tables than I do at the food table, so that's a really good thing.
No, that's true. They are around the perimeter of the room here.
Yep.
How many vendors or displays do we have here?
We had about 26.
Really? That's great.
And we had over 100 people sign up to come tonight. So
really,
and basically the goal is to get people to know what is available to them here in the county, so that they can take care of themselves, get the screenings they need, and find out where they can go to get that just what resources are available, so they can take care of their health.
Okay.
Now,
very good.
We have our CEO here, and I'll let her speak to you for a minute.
Well, let's talk to her.
She'll be here.
Right here?
Mm-hmm.
All right. So while Georgia's getting the new CEO of the hospital here, we're going to talk to this young lady right here. Hello. My name is Wayne. How are you?
Wayne. My name is Janie Jaberg, and it's a pleasure to meet you.
Well, we got Jane and Wayne here, right?
Jane and Wayne.
Janie, or is it Janie and Wayne?
Whatever you want to say, I'm good with it.
That works for me. So, welcome to Wayne County.
I am honored to be here. I am so honored to be here.
Tell me about Janie Jaberg. I'm sorry.
Well, let me tell you a little bit about Janie Jaberg.
Sure, tell me about you.
I am all about the patient. I am a nurse by background, and I've been in healthcare administration for more years than I want to tell you. But I love it, and it is about the patient. It's about the community you're in, and that's where I am, and I love Wayne County.
Oh, bless your heart. Where are you from?
I'm originally from Ohio, but I've been in the South for a while.
Well, good for you.
I know.
You finally found it, huh?
It's very cold up there right now.
I know it's cold in Ohio.
And it's beautiful here.
Well, we try.
It is wonderful.
How about this hospital?
Is it not wonderful? It is amazing.
How is UNC working with Wayne Memorial Hospital?
In so many different ways. Not only in supporting us in some of the new and exciting ventures that we want to do, but focusing on strategy, recruitment of all teammates and physicians, and just about any way that they possibly could put their hand out to support us, they have, and it's been amazing.
Oh, that's great. Well, Janie,
it really is.
Welcome to Wayne County.
Thank you.
And we're happy you're here.
I am very happy.
I hope
to be
you
here.
enjoy it.
I will. Thank you so much. I appreciate you being here.
Well, I wouldn't miss this. Are you kidding? You got food out there.
I know, and you see healthy food too. I want to point out.
I know you did great.
There may be some extra sweets, but it is about the health.
It's balanced though.
Healthopoly.
Yeah, Healthopoly.
That's right. Healthopoly.
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 Glad you said that. Yeah. Hey, thank you. Good talking with you.
Thank you so much. It was great talking.
Let's do this
to you.
again.
I would love to do this again.
Okay.
I am ready.
Now what is your name?
Melissa.
Now we're talking with Melissa. And Melissa, what's your table about?
I'm from Wayne Memorial Hospital Mammography Department
Okay. Why is mammography so important?
because early detection saves lives.
No question about it.
No question about it.
It works.
It does.
Early detect. Now, what's the best way to early detect? How do you do that?
Start with your yearly mammogram at age 40. See your doctor every year.
Age 40 now?
Age 40.
Is that new?
Guidelines. No, it's changed a little.
I thought it
over
was
years.
50. But
No, it's 40.
I'm glad. Maybe it's even younger, perhaps.
Yeah, well, it's 40 according to the American College of Radiology.
Okay.
Yep.
All right. Well, they should know.
Yep.
They're the experts.
That's right.
All right. Now, then what do you do?
You just keep up with your doctor's appointments yearly. Make sure you have a physician and call and schedule your mammogram.
How important is self-examination?
It's good to know yourself and know changes in your body and changes in your breast that you can report to your doctor.
If you feel something, is it always a lump of cancer or something?
No, it could be anything.
It could be anything.
But you don't know until you get it checked. So that's why having your mammogram is so important.
And you should self-exam very often.
Monthly.
Monthly, at least monthly.
Mm-hmm.
And you get your yearly mammogram once a year.
Once a year, that's right. That's right.
All right. Thank you.
You're welcome.
Appreciate
Thank
you talking with
Yes,
us.
sir.
Sure. And your Goldsboro Medical Clinic. And what are your names?
Jamie Hill. Summer Shizak.
Jamie Ham.
Jamie, and Summer.
Yes.
Wow.
Jamie Sandwich.
Oh, it's a Jamie sandwich. I was going to say that, but you know.
I beat you to it.
What do you do?
I'm a nurse practitioner at Goldsboro Medical Clinic.
All right. And where is that?
It is just down the street from here.
And who's your doctor?
We have Dr. West, Dr. Crowder, and Dr. Cuttapaw.
All right. And what are you telling people here today? What's important?
Prevention. Prevention is our big thing in our office. We also have some poster boards as far as hospital follow-ups, diabetes education, and then also Medicare wellness
All right,
exams.
now, when you say prevention is important, against what?
I'll let you take
Jamie.
Jamie.
Take it.
We like to make sure that our folks are protected against diabetes, make sure that we prevent any kind of diseases such as colon cancers, coronary disease, make sure our folks get good skin checks periodically, make sure they know the benefits that Medicare provides to them, and most importantly, the thing that we're advertising and pushing really hard is making sure that folks let us know when they're in the hospital so that we can see them for hospital follow-ups.
What can an individual do to protect himself or herself against diabetes? What do you do?
Most importantly is make sure that your diet's good, make sure that you have routine screenings at the doctor's office, make sure that you exercise. Most guidelines say that you should have about 20 to 30 minutes a day, 5 to 6 times a week, and eat diets that's good, low fat.
Is diabetes hereditary?
Yes, there's some things that we can change, some things we can't change, and hereditary is one of them.
So if it's in your family, that means you're subject to diabetes, right?
That's correct.
All right. So what do? You eat right?
Eat right, exercise daily, come into your doctor's office for early screening.
And what are your hours, Jamie?
We are open Monday through Thursday, 8 to 5, on Friday, 8 to 4.
So besides diabetes, what else is important now?
Listening to what these guys tell you to do. And I just make sure they show up.
Okay, good. You go get them. All right, thank you, folks. All right, thank you. Right. Gee whiz, hi. You are?
Melissa McCullen.
That's exactly right. And you are?
Jennifer Barwick.
Right again. You are?
I'm Donna Grady.
No, you're not. No. No, that's not right. No, what's your name?
Donna Grady.
Oh, that's right. Yeah, thank you. All right, Goldsboro Orthopedics. What do you do? You ortho and you pedic, right?
That's right. So you need to come see us for our joint replacements.
Actually, I've been there a few times.
I knew you have.
Yeah, I've been there several times.
And Dr. D has been to see you.
Yes, he has a few times. In fact, my finger's still crooked.
That's I'm sure. So come to see us with your joint issues. Yes.
My joint issues, yes.
That's right.
Well, I got a pain in the neck, and well, I won't tell you about him. But anyway, the Goldsboro Orthopedics been there a long time in a beautiful building at the end of
Cox
Boulevard.
That's right. Mm-hmm.
And the what are mistakes are most people making now as far as their joint health is concerned? What are they doing wrong?
Probably having too much weight. We need to make sure that we are super conscious of our weight and making sure that we are active.
So it's not just being overweight that's unhealthy for you. It also puts a toll on your body.
That's right. That's correct. Yes.
And it hurts.
Yes. So come see us when it hurts.
You're telling me that again. Okay. All right. So what do? We lose weight.
Exercise.
No, don't smoke. Don't drink. Don't have any fun.
That's right. And then just come see us.
And then come see us. Okay.
Yes.
All
But
right.
I do want to introduce Melissa McCullen is something new that we are going to be having. It is an orthopedic nurse navigator. So she's going to follow our patients through their whole total joints. So as you decide that you're wanting to be scheduled for total joints, she's going to be following you the whole way through.
All right. What does that mean, total joints? What do you mean?
Like your hip, knee, or shoulder replacements.
Oh, okay.
Yeah. So meet with the patient, screen them pre-op, make rounds on them in the hospital, follow up with them as they're getting their rehab, and then seeing them up to 1 year post-op to make sure they have regained their function that they had, and they're meeting their goals.
What are some of the mistakes people make? They come to you and they get repaired and they go home and they say, I don't need to do that. What are they doing?
Well, their joints they'll get stiff, and so they're not able to move those knees, and so they need to make sure they're using them. They're trying to protect them when actually you need to go ahead and use those.
Use them. Mm-hmm. Instead of saying, if I move, I'm going to hurt myself.
Right.
Don't do that.
Right.
Move.
Got to work through the pain. Work through the pain.
No pain, no gain.
That's right.
Okay.
And this is Sarah Mullins.
Hey, Sarah. Hi. What's your name, Sarah?
Sarah Mullins.
That's right. Okay. You're a winner. Okay. What do you do?
I am the surgery scheduler.
Oh, you're the one.
Yes.
She's the one. That's right.
Okay.
I'm the one.
Yeah, okay, yeah. You fixed my shoulder while you scheduled it. Anyway.
Yes. I didn't do the fixing.
No, you didn't do the fixing. Okay, so you schedule for surgery.
Yes.
Yeah. How often do people need surgery when they have an ortho problem?
Only when the doctor says.
When the doctor says, that's when you do it.
They do MRIs, X-rays, and then they make a determination.
Okay. All right. Well, that's usually a last resort?
Yes, it is.
It's a last resort.
We try therapy, injections.
Medicine.
Yes.
You might even call Scott Gibson. Who knows?
That's exactly right.
Exactly.
Right. Who knows? Okay. All right. Thank you very much. Nice meeting you.
You too. Thank you.
All right. Let's see what we have here now. You are Amy
Sasser.
Amy Sasser.
Yes.
Hi, Amy.
Hello.
Amy, you're with CT Lung Screening. Is that right?
I am. This is a program we started last year here at the hospital.
At the hospital.
It's an annual screening program, similar to like a mammogram program.
Okay.
So you have to meet certain criteria, which is listed here between the ages of 55 and 77. No signs of lung cancer. You are a current smoker or quit smoking within the past 15 years, and then we do a quick calculation on what we call your pack years, which just calculates the number of packs you've smoked.
I smoked years ago, as most people did, and I'm not letting the cat out of the bag here. I've talked about this before.
Right.
And it takes a while to get, the body will re-heal itself.
Correct.
It will heal itself, but it takes a while.
Mm-hmm.
And you have to really work at it.
Right.
Years ago I did smoke. I gave up smoking, and I kind of floundered around, and then a few years back I started exercising, feel much better, lost some weight and all that stuff.
Awesome.
But you have to do this but quitting smoking is not easy to do.
Yes.
That's one of the hardest things anyone ever did.
Right.
To quit smoking, you have to really want to do it.
Yes, sir.
If you don't want to do it, you're not going to do it.
That's right. And
So-
your body will heal itself, but some of that damage has already been done. So even if
Exactly.
you're a former smoker, the lung screening program can still start. You have a baseline, and then every year you get screened, and any changes will be caught, and you can go from there. Hopefully you would never have any changes. Nothing would ever be found, but the screening is a good low-dose way. It doesn't use much radiation, so you can kind of get a baseline and then follow it every year.
And then each year, do you need this each year? If you start once,
It's
you need to do it
recommended to have it every year, annually. Yes, sir.
It's recommended to have it every year if what?
If you meet the criteria.
Okay, again,
Between the ages of
55
and
to 77.
no signs of lung cancer, current smoker or former smoker who has quit within the past 15 years, and then we figure your pack years, which is a simple calculation, number of packs per day for how many of years. It has to be at least 30 years. So if you smoked a pack a day for 30 years, you're 30 pack years. If you're 2 packs a day for 15 years, 30 pack years.
Wow.
So that's a little simple calculation.
Okay, now if you quit beyond 15 years ago, let's say if I quit 30 years ago,
You don't meet the criteria.
I don't meet the criteria, so I don't need that.
It's not recommended.
Not recommended.
Not recommended. Yes, sir.
Okay, that's good.
Yeah.
Isn't that good?
That is great.
That is okay.
That is great.
All right. So that's here at the hospital.
Yes, sir.
So what do you make an appointment for this, or
You
does a
have to
doctor
have a
recommend?
doctor's order.
Okay.
You have to meet with your doctor first to get the doctor's order.
Okay.
And then we set up an appointment with you. Usually we can get you in within a day or two at the most. We send the report back to your doctor. So that's who you get your final report from, which would tell you hopefully no signs of lung cancer. Continue with annual screening. If we did see something small, then your doctor decides how to follow up on that.
And you would see what? Perhaps cancer, maybe?
Maybe.
Maybe.
Could be cancer. There's incidental findings, like if you have a pneumonia or something like that, which you shouldn't have because, you won't have
Anything. You could see anything. It may not be cancer.
Anything, yes.
Okay,
It's
so-
a low dose, so it's not what we call a diagnostic, and not a diagnostic testing, but it's a screening. So it will detect even small lung cancers.
Okay. This is a CAT scan.
Correct.
Okay. Good.
Yeah.
All right. This is good. Thank you very much.
Thank you.
All right. Hey, man.
You doing all right?
I'm doing fine. What's your name?
Johnny Williams.
That's exactly right, Johnny. How you doing?
Doing great.
You are in the sleep lab. Now,
That's
what
right.
in the world? Who could have a better job? I'm telling you.
That's right. We get to sleep when we're not. We're working.
I know you're working, but your patients, who would use a sleep lab?
Folks that have excessive daytime sleepiness, maybe falling asleep at a stop sign, or they go home and they sit down and they go to sleep anytime. People that have atrial fibrillation in the heart, rapid heartbeats that didn't know about it, type 2 diabetes, high blood pressure uncontrolled. Those folks have it also. A lot of them do, and they do not realize it.
People sitting in front of a computer screen at work fall asleep.
Well, that's some. They could, because really if you're sitting in front of a screen, you really should not be falling asleep, because you don't want to be sitting in front of a screen prior to going to bed, because it keeps you awake. So if you can fall asleep at your computer, then you probably already got some problems going on.
Oh, really?
You could.
Okay.
You could.
All right, well, tell me about some of the stuff you're using here. What is all this?
This is some CPAP masks for people that do have obstructive sleep apnea. I've got different masks just to show that everything is not big and bulky, that we have a really small size, and pillows that fit just up at the nose or right against the nose. And then we got one for claustrophobic patients that actually fit right up against the nose and over the mouth, so that it doesn't bother them. They can still wear their glasses. So this is a new type mask that's come out.
Because up until now, everything was big and bulky.
Everything was big and bulky like this.
Oh, yeah.
So that's the whole thing.
Who wants to use that?
That's right. That's right. But that's what I wanted to show tonight and go over with the folks and let them know that we do have things to help them sleep. Good night tips and sleep tips and things like that.
Okay. What could happen, Johnny? What could happen with someone who has sleep apnea and doesn't take care of it?
Then they can have a heart attack, stroke, or even die in their sleep.
Wow. That's not good.
No, and we've had young folks as well. And we have...
So age doesn't matter. Anybody.
Age doesn't matter, and weight does not matter. We've had people that weighed 300, 400, 500 pounds and did not have any apnea, and people that weigh 100 pounds and stop breathing over 125, 30 times.
So what causes all this?
Well, a lot of it is airway resistance, and what causes it, they're not really for sure. Besides the airway resistance and the enlarged adenoids, tonsils, uvula, things like that you would want to get checked out by your physician. So there is a lot of different things. Overbites can cause it. but
Really?
some people they don't really know.
So how does somebody, what does somebody do? Do they come to you, or their doctor recommends coming to you, or what?
Yeah, they actually go to their physician and they let them know they're having problems sleeping, and then they actually will evaluate them and then send them to us. But they have to have an evaluation.
And once they come to you, after the evaluation, they come to you and you fit them for this, or ma'am, watch the camera there.
Yeah.
All right.
If when they come to me, they first get a sleep study to prove if they stop breathing, and we try to figure out why and how many times. Then if they do have it, then they come back and we try to fit them with the CPAP.
Okay.
Okay, and that's continuous positive air pressure.
All right.
Okay.
Continuous positive air pressure.
Right.
CPAP.
CPAP.
I got it.
Yep.
All right. I figured that out. Thank you.
Thank you.
All right. I appreciate it.
You're
good
welcome.
information.
Thank you. It's
All
good
right,
seeing
Don.
you again.
Good to see you. Hey there.
Hi, how are you?
I'm fine, Donna Peden. What's your name?
Donna Peden.
That's exactly right.
All right.
All right. What do we have here?
Okay, this is a stress ball.
A stress ball.
Yes.
For people who are stressed.
Yes.
Are you stressed?
No,
Have
not
a ball.
today.
Oh, you're not stressed. I'll keep the ball. Thank you very much.
Thank you. That's right.
All right. Okay.
This is for cardiac rehab.
Cardiac rehab. Tell me about it.
Okay, we have an outpatient cardiac rehab program that is for individuals who are recovering from heart attacks or heart surgery. Maybe they've had stents, maybe they've had valve surgery, maybe they've even have a cardiac transplant. So this is to get people back on their feet again. It's an exercise program, but there's a whole lot more to it than just exercise.
Oh, I'm sure. There are people who have not had a heart issue find it, they don't understand that you have to work at it once you have a heart issue or heart replacement or heart anything like that. You have to work at it, and it takes work. You have to get up, you have to move, you have to exercise, you have to eat right.
Absolutely.
All those things.
And we just get them started. This is rehab. We are getting you started on the program that we expect you to be on for the rest of your life.
Once you start, you better not stop.
Never stop.
Never stop.
No vacations either.
What? No way. You can't stop for vacation?
No, you take a vacation, but you still exercise.
You exercise while you're on vacation. Well, that's okay, though. What are some of the exercises that people do after they've had a heart replacement?
Well, the main thing that is going to be cardiovascular type of conditioning type of exercises, but we also incorporate balance training, flexibility, strength. But the cardio is the biggest portion of the exercise session, but it's not all of it. You've got to have the whole program.
And what happens if you don't exercise?
Well, you're not going to modify your risk factors, and that's what this is all about, is risk factor modification. This is a lifestyle. This is a lifestyle change. And if you don't modify your risk factors, you are at risk of having more problems down the road.
So it could all happen again.
Absolutely can.
Yeah, well, that's not good. So is this? Oh, this only happens to elderly people, though. Really, I mean, people that are just
not at all.
All older people, old people.
All ages. Nobody's immune.
Anybody can have a heart attack.
Anybody can have heart problems, heart attacks. People who have a genetic tendency, it runs in their family. Of course, they are at high risk, but that is a risk factor that we can't control. Your family tree. So then we want to start working on the things we can control: diet, exercise, control your diabetes, don't smoke, watch your cholesterol, things like that.
Donna, every once in a while you hear a tragic story about someone who was in the tip-top health, in the best of health. We had a judge pass away last year here in Wayne County who was in immaculate. He was perfect. He exercised, played ball all the time, and he dropped just like that.
He did all the right things.
Did all the right things. How do you prevent that, or is there a way?
Well, you always want to control for risk factors, the ones that you can control for. Now, you have to remember, there are uncontrollable risk factors: age, sex, family tree. Those are the biggies, okay? So, if a person who has that genetic tendency for heart disease, yes, they really need to work on the risk factors that they can control. So it always comes back to lifestyle.
Yeah.
It always.
You mentioned age, sex, and...
family tree.
Family tree, yeah. But now, what about sex? What's the difference?
Okay, heart disease is the number one killer, males and females. It just tends to happen a little bit sooner, okay, in the males than the females. We tend to have a little bit of a protection there up until menopause, and then it tends to equal out. But it's the number one killer, males and females.
I hear that a male having a heart attack often survives. A female almost never. Is that true?
Well, there is a little bit higher mortality there, but the symptoms are very different too. Females have a tendency to brush it off a little bit more because the symptoms tend to be a little bit more vague. And unfortunately, they brush them off. a little bit more.
That's not good.
No, it's not.
So what are the symptoms? If you're having heart palpitations, what do you do? If you
The first thing people think of is chest pain, but females may not have that hard, crushing, heavy chest pain.
You may not have
They
it.
may not. Females might not. They might be more vague. It might be just a little twinge, maybe, a feeling of uneasiness, maybe a little bit of pressure, a lot like indigestion, and so it's oftentimes mistaken for indigestion. But most do have some form of chest pain. But there are some individuals who don't have any chest pain. They may have what we call angina or chest pain equivalents like shortness of breath, things like that. Yeah.
So climbing steps, you get shortness of breath climbing steps. That doesn't mean you're going to have a heart attack, does it?
Oh, no. No. Anytime you increase your workload like that, your respiratory rate has to increase, okay? I mean, you're going to breathe more times per minute. Whether or not you're short of breath might be a different story, and that's where you're gasping or something like that. No, that is not normal, okay? But if you have excessive shortness of breath, sudden onset, not related to an activity, that could be a sign.
Okay. All right, Donna, thank you so much. Now, people can contact the hospital or see their own physician about
cardiac rehab. We have to have a physician referral. All you have to do is just talk to your physician, and they will give us the referral, and we'll take it from there.
Excellent. All right, Donna Peaton, thank you. All right, okay. Now we're talking with Linda, and Linda, you're with the hospital?
I am. I work at the Center for Nutrition and Diabetes Health. I'm a diabetes educator.
Are you really?
I am.
Wow. Okay, let's talk about that.
Okay.
All right, what is diabetes?
Diabetes. What is diabetes?
What is?
Where
I'll ask you first.
Type 1 diabetes is where your pancreas does not make any insulin. Type 2 diabetes is where it doesn't make enough.
Type 2 is a lot more common, isn't it?
It is a lot more common, but there's really, one's not worse than the other.
Really?
It is. What makes it worse is your control of it.
Ah, okay. Okay, well, give me the good and the bad of diabetes 1.
Well, it's the same. The bad with diabetes 1 is the pancreas doesn't make insulin, so
At
you
all.
always have to take insulin.
All right, how do you do that?
How do you take your insulin? You get an order from your doctor.
Well, I know. I realize that. All right.
You do.
All right. It's not oral.
It's not oral. It's an injection.
Right.
It's an injection. So, and you take your medication. It absorbs best in the belly, but you can take it in the belly, in the fatty parts of the arms or the legs, and even the buttocks.
Right.
So, and that's an injection that you take either with meals or at supper time. And sometimes our type 2s have to take insulin as well.
Is that right?
That is.
So type 2 diabetes is more common, but you still have to take sometimes, as you say.
Sometimes people do, and it just depends on the control that they have. If they're overweight, that raises your risk factors. If you're not physically active, that raises your risk factors.
So if your body is not making any insulin or not making enough insulin, what does insulin do?
What is insulin? Insulin, when we eat our food comes in, it's metabolized through the liver. And the liver breaks that food down, and it sends it wherever it needs to go. Well, some of the carbohydrates and starches are broken.
Ma'am, there's a camera right here. So you have to go around the camera. I'm sorry.
It's fine.
Say that again. I'm sorry. Don't want to get you on film. See. All right. Now, I'm sorry.
When we eat some of our food, it has carbohydrates and starches. Our liver breaks those carbohydrates and starches down to glucose. The glucose is needed for our energy source, for our brain, for our muscles, for everything. But as soon as we have the glucose, the pancreas begins to make insulin. And you have to have equal parts of insulin to glucose so that it's a key to go into the cell. So if you don't have enough insulin, then the sugars are elevated. They're high. And those elevated blood sugars can cause damage to the eyes, kidneys, nerves, and blood vessels.
Okay. And that's why you see sometimes people losing limbs, or
Yes,
perhaps
it is.
having eye problems, perhaps losing their sight.
It is.
It really gets bad.
It can get, uncontrolled diabetes can get very bad, and it can lead to blindness. It's the second leading cause of amputations. Can lead to kidney failure, and patients have to go on dialysis. It can raises your risk factors for heart attack, for a stroke.
Thank you.
You're welcome.
All right, you're very kind, Linda.
Thank you.
All right. I appreciate it. All right. Are they with you?
They
are. Okay, I won't talk to them. Well, what's your name?
My name is Marie.
Marie! What's your name?
I'm Haley.
Haley. All right, thank you, ladies. That was fun. All right.
We're back on Wayne Goldsboro Television. Don't forget, tomorrow is the Jerry Johnson Aggie Baller Classic Scholarship Tournament going on at the W.A. Foster Recreation Center on South John Street. That's going on over there. Starts in the morning at 9 o'clock. It is it's for all ages, but tickets are $10 for ages 12 and older, and tickets are $5 for ages 3 to 11. All right, that's tomorrow at the W.A. Foster Recreation Center. Coming up April 7th is the Wayne Shrine Club Spring Fish Fry, April 7th, from 11 till 2 and 4 till 7 p.m., and I'll tell you more about that in a few minutes. What's special about today? Let me reach over here and get my list. Special about today is the 24th of the month. Today is Red Rose Day, National Chocolate Covered Raisins Day. It is also Snowshoe Days today. There you go. Here's our trivia question. In Holland, they call this a monkey tail. In Israel, it's a strudel. In Russia, it's a little dog. And in Italy, it's a small tail. And you find it on your keyboard. A monkey tail in Holland. In Israel, it's a strudel. In Russia, it's a little dog. And in Italy, they call it a small tail. It's on your keyboard. What is it? We'll have that answer for you coming up in just a few moments in the next segment of the program on Wayne Goldsboro Television. Bert Bridger, I'm Wayne Alley.
Hey, Wayne. Hey. Good to see you.
Bert, the Goldsboro Skin Center, tell me about that. What do you do?
We're at private practice with Dr. Jennings.
Okay,
We're
sure.
across the hospital.
Across the
Yes,
road over here.
yes,
Sure.
sir. And we do skin checks and checks on moles and skin cancer and anything having to do with the skin.
I imagine that you stay pretty busy doing that.
Yes, sir.
I see a lot of moldy people around.
Yes, sir. Yes, sir.
But now, just because it's a mole doesn't mean there's anything wrong. It could be just a mold.
That is correct. But it's good to have somebody who's has that keen eye to kind of look over those things.
Because the layperson just doesn't see what a trained physician can see.
Not always. That's correct.
So regardless of how good it looks or how bad it looks, it needs to be looked at.
Absolutely. Usually once a year, we're kind of checking on moles in your skin and making sure everything's doing okay.
So if it starts out as a mole and they get it checked and nothing seems out of place or anything wrong, that doesn't mean that it won't become that way.
You can't always predict and kind of know what it's going to do, but taking a careful history and history of whether someone's been in tanning beds a lot or been a farmer, been out in the sun a whole lot. A lot of things to kind of put together for that.
How do you, for people who love the sun,
yes,
I know, and you shouldn't. You shouldn't love the sun. But I understand. And but for people who are out in the sun a lot or more than they should be, what do they do? I mean, you get sunburned and.
You certainly can. I mean, it's important to, if you are out in the sun, make sure that you have good protection. Make sure that you're using good sunscreens, trying to avoid the hotter times of the day, and certainly avoiding tanning beds and things of that nature. So,
tanning beds. I see people still using tanning beds, and tanning beds have had a lot of bad press here of late.
Yes, that's correct, because there's nothing really healthy about those particular rays. They're very it really increases your risk for melanoma skin cancer. That's the kind that can be malignant and travel and go places, and
you can die from it.
Yes,
you can die from melanoma.
Absolutely, yes, sir.
How common is that?
More common than I like to talk about, but yes.
So I see. Not that you're promoting these items necessarily,
Correct.
But I see Aveeno here. I
Yes.
see the skin products here.
Yes.
When and why would you use these?
Well,
obviously you want to protect your skin.
Correct, and your skin's the largest organ in your body.
Yes.
And so it's important to kind of keep moisturized, and certainly during the winter months that we're kind of coming out of it, it's important to make sure that you stay moisturized really well, because a healthy skin promotes good health. That's what we're here for.
So, aside from being out in the sun too much and not protecting yourself, by the way, give me a good level that a product that we should use for what's a good SPF rating?
Good question. At least a 30. That's
at least a 30.
That's the kind of magic number.
So you wouldn't want to put on 2 layers of 15.
Good question. No, it's not an additive thing.
You could pile it up. Yeah. Let me put up 15 layers of 2, right?
You're right, but at least a 30 SPF. And another important thing is making sure that you reapply. Because these sunscreens, sometimes we put them on and we get kind of a false sense of security, thinking, oh, it's lasting all day. But no, after about 2 hours, it kind of poops out.
Oh, does it?
Yes,
So
sir.
every couple hours you need to reapply.
That's the important thing.
Okay.
A lot of people have great initial intention going out, getting it on, okay, great. Then they get out and having fun and get in the water and go fishing or whatever they do, and they forget about that.
Yes. What about hot water when you're showering?
Cooler, shorter baths are probably better. Not the staying there and, sauna or whatever. So.
Okay, you don't want to get too hot. Don't want to get the water too hot. What happens?
No, you just dry out your skin.
Okay. Your skin, it's better for your skin to have a little oil.
Certainly. I mean, our skin normally produces a little bit of oil there too. So.
It may not seem that way. But,
correct.
But it's there.
Correct.
All right. Dr. Bridger, thank you. I appreciate you talking with us.
Thank you very much, sir.
All right, there you go. What are you doing?
All right, we're talking about MedlinePlus.gov.
MedlinePlus.gov.
Yes, sir. It is a patient database through the National Library of Medicine. It is completely free, and it's designed to help patients. Obviously, it does not replace a physician. They're the pros. But if you have questions until you see the physician, or say you went to the physician and you can't remember everything, this is a good resource to go to. There's over 6,500 different topics there, and it will actually link to different authoritative websites, not only through the National Institutes of Health, but also Ochsner Clinic, Mayo Clinic, Johns Hopkins University, American Diabetes Association. And it's a wonderful resource.
This is not meant to replace a physician, as you say?
Correct.
If you have any questions at all, you could go here first.
Yes, sir.
And get your questions answered. And
Yes,
from
sir.
that point, go and talk to your physician about it.
Yes, sir.
Well, Jerry, that's neat.
Or they can come see us in the library at the hospital. We're on the ground floor by rehab. Either myself or the other librarian will be more than happy to help you.
Is that right?
Yes, sir.
Now, you're not a physician.
No, sir. I'm a librarian.
Librarian.
Correct.
So
I can help.
Someone comes to you and they say, I want information on heart failure. I want information on diabetes. What do you do?
We can do it. May I?
Sure.
All right.
Right over here. Here we go.
Or you can shoot up there because
okay.
it might be easier.
All right.
You said diabetes.
Right. Let's look at diabetes here.
When we type in up,
right. How we
one
doing?
second, I misspelled it, but it will have correction.
Oh, okay.
Do you mean diabetes?
Yes, we did.
And as you can see, there's over 5,600 different items.
Wow. Okay.
All different websites, and they've been vetted by the National Library of Medicine.
Okay.
Let's say type 1.
All right.
It'll give you basics. It'll give you a summary. As you can see, diagnosis and tests that can be done. It'll talk about the research that's going on, clinical trials. And then, as you move down, it'll give you websites that you can go to for additional information.
Okay. Well, that sure seems simple enough.
Yes, sir.
And they can do this
at home.
At home.
They can do it at the public library, or they can use it at the hospital.
They can come here and do it.
Yes, sir.
All right. And where's your library again?
We're on the ground floor near Rehabilitation Services.
Okay.
Yes, sir.
Very good. All right. Well, Jerry Judd, thank you, sir.
Thank you, sir.
I appreciate that information.
You have a good one, sir.
Yes, sir. What's your name?
Nancy.
Nancy.
Kirby.
Nancy Kirby.
Yes.
Okay, good. Now, and what's your name?
Angie Smith.
Angie. Well, we're talking poison here, and you're here at the hospital pharmacy. Is that right?
That's correct.
Okay. What mistakes do people make in their own home when it comes to poisons? What are they doing? What are they doing wrong?
With poison or medications? With poison.
Okay, you tell me.
Well, poison, they're probably storing them where kids and people can get in contact with them, and keep it away from food and other things. You need to keep it separate.
Keep the poison separate. Where do you keep them?
Well, the best place is in a locked cabinet.
Not under the sink?
Not under the sink. Up high.
What happens under the sink? Can
Under the
kids get
sink.
in there?
Absolutely.
Yeah. Yeah, that's not good.
And they're usually pretty colors that they think looks like Kool-Aid or...
Yeah, so their kids are attracted to the poisons. Now tell me about medications.
So what we have here today is something a lot of people ask, and they want to return medications that have expired or their doctors changed them and they're no longer taken.
Yeah.
So these are some drop-off locations this week because you have to be certified to receive those back.
Right.
So you don't want them in the water system anymore. We don't want you flushing your expired meds. So these are some drop-off locations. And then another good idea is these are cards for people to keep in their purse or in their wallet. A quick reference of what medications you're on, somebody to contact in an emergency, any allergies.
Okay.
So if you were somewhere and had a wreck or had, something where you couldn't talk, people could get to that and know what medications you're on.
So where do you keep this?
Either in your purse or in your wallet. Keep it with you at all times.
Okay. Keep it with you at all times. Now
In case you have a heart attack or a stroke and you're unable to speak and emergency help comes for you, then they can find this in your wallet or your purse, and it's all filled out, and then they can give it to the emergency room.
So they will know immediately if you're in an accident and you're not conscious. They can look at this and they say, "Oh, this man has allergies to whatever medication.
Correct.
His doctor is so and so. He is. This guy takes a Atenolol. He takes all kinds of medication here. He takes this, that, and the other, and the dose and how often and all that. So everything's right here.
Yes.
Everything.
Yes.
So the person who's in an accident is not conscious. I'm going to keep this, okay?
Yes.
Thank you.
Sure
I'm going to
can.
take two, okay?
Okay.
But don't tell anybody. One for each hand.
And then
And what is that?
The other information we have is
for stroke.
signs and symptoms of stroke.
All right.
So that's very nice to have, so that your family or anyone would be able to recognize the signs and symptoms
All right.
of stroke.
Tell me about FAST. What is that?
So FAST means face.
Face.
So you look for an uneven smile. So it would be a crooked smile.
So you would tell the person who may be having the stroke to smile.
Right.
And if their smile is crooked, that's a sign right there that
Exactly.
they may be having a stroke.
And then the arm. So the A stands for arm. Check if one's arm is weak,
Okay. So if it's weak.
meaning that they couldn't lift
They
it,
can't
they
lift-
couldn't move it,
Okay.
they can't move their fingers. And then speech, you're going to listen for slurred speech.
Okay.
And that's the S. And then the T is for time, so it means you need to call 911 right away.
Right. Immediately.
That's important.
Now, chances are, if they're experiencing all this, they could be having a stroke, and probably are. It doesn't mean they are, but the chances are good that they will be having a stroke. So it's always best to go ahead and call 911, regardless of whether you think they are or they're not.
That's true.
Better to be.
The time to recovery is as soon as we can see you, so that we can get the medications on board. So that's why we don't want you to wait and say, well, let me see if they're going to get better. You need to call immediately.
Information on common
Excellent.
drug and food interactions. A lot of people think that food wouldn't interact with your medications, but there are a lot of foods, different types of foods that can interact with your medications.
How do they interact? What do they do?
They can either make the drug work too quickly or not work fast enough.
Really?
Or they can affect the absorption of the drug when it's taken with these certain foods. For example, the broccoli or kale interacts with your blood thinners such as warfarin or Coumadin. And then your grapefruit can interact with your statin drugs like your Pravachol, your Zocor, those types of medications. And bananas contain potassium.
Wow.
So there's a class of blood pressure medications called ACE inhibitors that already increase your potassium. And if you're intaking more potassium, you can get too high of a level of potassium, which can cause irregular heart rates or heartbeat.
Okay, so if you're on an ACE inhibitor already, you don't need to be eating bananas.
True.
All right, well, ladies, thank you. Very informative. Lots of good information there. All righty, I'm going to take that with me, okay? All right. Hello. I'm fine. What's your name?
Jennifer Hall.
Hi, Jennifer. Are you just standing here or do you work here?
I work here.
Okay, what do you do?
I'm a nurse on behavioral health unit.
Behavioral health.
Yes, behavioral health, psychiatric services. They're outpatient, we're inpatient.
Okay, so you're actually in the hospital here.
Yes, sir.
Okay, so tell me about what you do.
Daily, every day, I work as a psychiatric nurse, but I also work as a clinical educator, and I educate staff and help with them in the environment of therapeutic environment for people suffering from a mental illness.
Okay, now define, if you would, for me, and I know this is a silly question. Tell me about mental illness. What is mental illness?
Mental illness is a change in condition in how someone behaves or thinks, and their ability to make decisions change.
Are they dangerous? Are they harmful?
No, anybody can be dangerous or harmful. Mental illness.
Mentally ill or not, right?
Mentally ill or not.
Right.
So no, sometimes the behaviors that they stem from their mental illness does cause them to be dangerous, but it doesn't necessarily mean everyone is dangerous.
And are people who are mentally ill always over the top? They always hear voices in their head. They always see people standing behind trees, lurking, or
No, sir. Many people suffer silently with like depression or bipolar disorder, anxiety, and many people you work with every day probably suffer from it, and they get treatment for it, but are able to manage a good daily life. That's an extreme psychosis. Mm-hmm.
Extreme psychosis.
Mm-hmm.
How much does medication help?
Medication is really effective with good management, but more than just medication. You have exercise, you have going to your visits with your therapist, you have many things that make it better, but medication does make you able to live a productive life instead of being shut in with a mental illness.
Why do people stop taking their medication? Because when they do, almost always get in some kind of trouble.
Because they start to feel better. Normally that feeling better, I feel better, I don't need the medication, they got to where they want to be, so they stop taking their medications.
That's pretty common, isn't it?
It's very common, and it's one reason we see a lot come in our unit is they were released on a good medication regimen, they got to feeling better, they started living a really good, and then they started not, or their weight, because medication with mental illness takes 4 to 6 weeks at times to work, so they don't be patient enough for it to work, so they stop taking it then too. So you see both sides of it.
So when they stop taking it, are they aware of the change or the reverting back to their sickness or illness?
We teach them.
Are they aware of that?
Yeah, we teach them, and then once you get at that level of living a productive life with a mental illness, and you start to see, you can see yourself progress downward. You know that downward spiral, so you can reach out and get help.
So when that happens, I need to come see you right away.
Yes, sir.
Right away.
Right away.
All right. Okay. Thanks for talking with us.
Thank you.
All right. Hello. What's your name?
I'm Dana Langston. I'm the clinical manager at Wayne Health Urological.
You are?
Yes.
Okay, Dana.
Yes.
Okay, Dana. So tell me about the urological. Is that a planet? It sounds like a planet somewhere.
It does.
Yeah, I'm from urology.
The biggest thing right now is Botox for the bladder, for leakage, for women.
Really?
Yes.
Botox?
It's awesome. It works wonders, yes. I know it's something a lot of people don't want to talk about is leakage, but it is a major problem for a lot of women. Yes.
It is a problem.
It is.
It is a problem. Why is it happening? What happens? What causes it?
You know, as we get older, things drop.
Yeah.
We have babies.
Yeah.
Everything
I heard about that.
goes down.
Yeah, I heard. Those things happen.
It happens.
You can't help it.
No.
So what do you do?
You come see us.
And what do you do?
Come see us.
Okay.
There's more information besides the medication.
Okay.
So there is Botox. There's also InterStim for the bladder.
I can't. Botox.
It's not just for wrinkles.
Well, that's good news, I guess, right? It's not only for wrinkles.
That's right.
All right. So you apply the Botox and then...
No, we actually instill it into the bladder.
Really?
It's a procedure we do in the office. Some patients end up doing it at the hospital, but it's actually very painless. So we do it in the office as well.
In the office,
Yes.
attach it to the bladder.
Yes, insurance does cover it. We
Really?
get it pre-authorized, and insurance does
Well, this is
cover
wonderful. How long has that been going on?
it. For a couple years now,
Really?
actually.
All right.
Yes.
Gee whiz, people need to know about that.
I know.
So does it eliminate incontinence? Does it help control it?
It helps control it.
Okay.
And a lot of patients, actually, it's eliminated.
Is
They
that right?
do wonders. I have a lady that's 90 years old that comes in our office and gets it and does wonderful.
Really? Bless her
Yes.
heart.
She said she couldn't live without it.
Well, and how often does she have to do this?
About every 6 months.
Well, that's not so bad.
No. It's better than taking a pill every day.
And insurance covers it.
They do.
That's
yes.
amazing. That's wonderful. Well, Dana, thank you for talking
You're
with us. That's great
welcome. You're
information. See,
welcome.
I'm learning stuff here. That's great. Thank you. What's your name?
Kim Kennedy.
That's right. Hey, Kim. What's your name?
Nancy Rodhoff.
All right. Now, what are you doing? What is it?
Raise awareness about organ donation.
Organ
For all
donation.
the patients who are needing transplant.
Yes. Because April is Donate Life Month. That's right.
It is.
It is. April is, and that's coming up. So why do we need to do this? Why is this important? Tell me.
Well, go ahead. There's over 120,000 patients waiting for transplant in the United States.
People needing transplants. They could die if they don't get a transplant. How many hundred and what?
120,000.
That's the entire population of Wayne County. It's the entire population of Wayne County, everybody. So what kind of transplants are we talking about?
Heart, liver, lungs, kidneys, and pancreas.
Those are the critical. Those are life-saving.
But we can also donate the corneas for people who can't see. So there are other parts that can be donated as well. So
You could just about, almost all of you.
you can. That's right. Some people donate their bodies to science too for
No, that's true.
medical purposes, for learning, and so. But as far as saving somebody's life, it would be heart, lungs, liver, kidneys, pancreas, and those are the life-saving organs.
So how do you donate?
You can sign up to be an organ donor at the DMV by putting a heart on your driver's license, or you can designate your wish at this website, www.donatelifenc.org.
DonateLifeNC.org, and you can sign up right here. If you go to that website, www.donatelifenc.org,
You will be able to designate your wish regarding organ donation and eye donation.
so you can specify, I want to give my corneas,
Yes, you can.
I want to give my heart,
Yes, you can. Lungs, liver, kidneys, or your pancreas.
one or all.
One or all. You can choose to donate everything or just whatever you wish to donate.
Okay. So you mentioned the DMV. If you go renew your driver's license, you can do it then.
Yes, they'll ask you, do you want to be an organ donor? If you say yes, then that'll automatically put a heart on your driver's license, and then you'll be on the state registry.
What happens if you want to, now this is a terrible question. What happens if you want to donate your heart and it turns out your heart is not a healthy heart? What happens?
Then we would not be able to use it, specifically your heart, but we could still evaluate some of your other organs. Just because your heart is not functioning properly doesn't mean your kidneys are not, doesn't mean your liver is not, doesn't mean your lungs are not.
So if your heart is sick, it's not going to be put into somebody else anyway.
Exactly.
They'll be tested.
Yes, very strict medical criteria that we evaluate.
You know, I don't think I'm sure that's been asked before, but I was just curious about that, and that's a terrible thought. But
it's reality.
It's reality, it is.
Exactly, especially in eastern North Carolina.
Yes, it is.
A lot of
Yes.
barbecue.
Well, yeah, lady. I mean, really, I'm a pig. I mean, I love pig. All right, thank you very much for talking with us.
We're here to talk about
Colonoscopy.
Have you had yours?
I'm due one now because I had one 5 years ago. Okay, so tell me about colonoscopy. Why is this important?
Early detection of colon cancer. If you have problems, it's always a good thing to find out what the problem is and have it corrected.
Is it true that colon cancer is one of the few cancers that is absolutely, totally, 100% preventable?
Yes, it is.
Yes.
Is that not wonderful?
Preventable.
Yes.
If you're subject to colon cancer, it can be prevented.
Yes, absolutely.
How do you do that?
By having your colonoscopies on a screening basis before you have a problem,
Okay.
and then every so often according to your doctor's recommendations.
Okay. So, no one enjoys a colonoscopy, but no one remembers it. They don't know what's going on.
Good medicine.
So what's the big deal? What's the big deal?
The prep.
The prep.
Oh, yeah, that's right. But actually, it's not so bad. It really isn't.
We have 2 new preps actually that has taken the place of the big jug. So now we have a prep that's 2 small bottles and 2 small packets that they can opt for.
No big deal. No big deal.
Big deal.
So how often does someone get a colonoscopy?
A screening colonoscopy should start at 50 unless you have a family history for needing it before or if you're having problems.
Okay.
And that's different according to the race, your sex. Your doctor would tell you when it would be
Because it can
required.
vary. Vary from person to person.
Yes.
So when the doctor finds a node or nodule or whatever you call it in your colon, what's done? That's snipped off, is that right?
A polyp, yes, it's
Polyp
removed.
is what I meant.
Absolutely. It would be removed during that procedure.
And then what happens to that polyp?
It's sent to pathology to be tested to make sure that it doesn't have any cancerous cells in it.
So there's a chance it's not cancerous.
Exactly.
Is it more common that it's not cancerous?
Yes.
So just because you have a polyp there doesn't mean that you have cancer.
That's exactly right. That's why you have preventive colonoscopies.
See.
But there's a chance it could turn into cancer. That's why we want to get those removed.
So when you remove them, what happens then? Are you still subject to cancer?
You could be. Once you've had a polyp, you're subject to grow more polyps, so therefore you would want to follow up with your physician more often, say like every 2 to 5 years, whatever your gastroenterologist would recommend.
Instead of every 5
every
or
10 years.
Instead of every 10 years.
Right.
Oh, okay. That makes sense.
Yes. We want to keep Wayne County healthy.
Yes.
That's why we're here.
Go Wayne, go.
So, what do you do?
Oh, I'm the secretary.
Oh, you don't know anything?
No, I run the whole department. I'm the princess. I'm the princess.
You're the princess.
Yes.
I've heard of you.
You have?
Yeah.
Oh.
They said you got to talk to the princess.
Oh yeah. Well, so yes, I make all the charts for the patients and.
Oh, is that you?
Yes.
She does what?
She makes our follow-up appointments and reschedules our patients, puts them on the follow-up.
Well, then why am I not talking to you?
Because she's the supervisor.
Oh, okay. And they know everything.
They know everything.
They know everything.
She knows everything behind the scenes.
Oh, we don't want to go there. What was your name?
Jamie.
Donna.
Teresa.
All right. Well, ladies, thank you very much for talking with us and explaining to us why colonoscopies are so important. And they are.
Yes. Absolutely. Make
Thank
sure you schedule with us. Make sure you schedule it.
Oh, no question. No question at all. I'll do it. We're back on Wayne Goldsboro Television. The Wayne Shrine Annual Spring Fish Fry coming up Friday, April 7th. Oh boy, I love this thing. I go to all of them. Yeah, because I love what they do. I love the Shriners and what they do, but I love their fish fry as well. It's only $8 a plate. Give it a little extra if you can. Lunch from 11 till 2 and dinner from 4 till 7 p.m. It's an all-day affair. In Goldsboro, drive through Herman Park or eat in at Herman Park Center. In Mount Olive, drive through on Highway 55 across from Mount Olive Center, right next to Robert's Machine Shop. Fried fish, coleslaw, potato salad, and hush puppies. It's delicious, it's good, and it's going to a wonderful organization. That's April 7th. That's a Friday, Fish Fry Friday. The Vietnam Veterans celebration of National Vietnam Vets Day coming up on March 29th at 10:30 at Veterans Memorial Park at the corner of William and Walnut Street, downtown Goldsboro, at 10:30. And then at 11:30, we'll all go across the street to the Wayne County Museum for refreshments, all right? Here's the answer to today's trivia question. What is a monkey tail, strudel, little dog, and small tail? It's on your keyboard, and the answer is, well, we call it the @ sign. @ Most often seen in emails, but also it's been around for a long, long time. That's the answer to our trivia question, the @ sign. We're going to do this again bright and early next week. We'll see you Monday. Have a great weekend. Drive carefully. And until then, I'm Wayne Alley, and this is Wayne Goldsboro Television.